Okay, I'm going to just turn it over to you, Mike, and you can take it away.
All right. Well, let me just add my thanks and appreciation to all of you on the call. You know, these Circle of Excellence programs that we host are one small way that we try to give back to our donor community who's given so much to Overlake for our 60 years. As I've said many times, Overlake wouldn't be the great institution that it is today if it weren't for our community partners and supporters, and that's all of you. And so thank you for that. And I, as a person who's been, this is my 36th year in healthcare leadership, and I've been now at Overlake for about 7.5 years, I can say that this is really, truly a special place. And I couldn't be happier to be have the privilege really to lead an organization like Overlake. Also, some of Dr. Garcia-Rabbat and Dr. Reeves' patients from the concierge clinic are able to join us here today, and we appreciate your participation as well and your support. And hopefully this will also, obviously, you know the presenter very well, and you know that she's a person of great standing and communication and insights around a whole host of topics. You know, once again, we got a great response, and so thank you for spending some of your time with us. You know, it kind of goes without saying, but you know, I tell all of my employees that we can't really take care of patients if we don't take care of ourselves, and that extends to the greater community. So I can't think of a more appropriate topic than wellness in the era of COVID. And Dr. Rabbat is prepared to share some of her insights with you today. You know, just by way of introduction, Dr. Garcia-Rabbat has been with Overlake for 3 years, and we're certainly grateful to have her. She attended the American University in the Caribbean School of Medicine. She completed her residency at the Lutheran Medical Center in Brooklyn, and she received her board certification in internal medicine in 2012. Probably the most important credential that Dr. Rabbat holds is that she's my wife's physician, which means she is a superstar, because I wouldn't trust such a precious individual to anybody other than a superstar. Dr. Rabbat will have plenty of time for your questions, and Molly talked about ways in which you can submit your questions, some of which have been submitted in advance, and we appreciate that. And with that, I'll just say once again, thank you for being here, and I'll turn it to you, Jenny.
Thank you so much for that kind introduction, and thank you for the opportunity to speak with all of you today. I know that the last 1.5 years has had many challenges as we face this unprecedented pandemic. It's taken a toll on us physically and mentally, and I hope this presentation helps in just finding strategies to better cope with ever-evolving time. The next slide. In many ways, the last 1.5 years has also kind of been a grieving process, as we've suffered the loss of our normal coping mechanisms and our normal way of life. Some have felt isolated and experienced anxiety about the uncertainty the future may hold. Many studies have been conducted which have shown an increase in depression, weight gain, avoidance of medical care, and an increase in drinking. In April of 2020, 14% of US adults had reported they always or often felt lonely. US obesity prevalences have been on the rise and increased from 30% to about 42%. And during the same time, the prevalence of severe obesity increased from 4.7 to 9.2%. The American Psychological Association, or APA, surveyed many Americans and found that the majority had gained more than 20 pounds in the last year of COVID. And the so-called quarantine 15 is a really real phenomenon, and for some has been as even high as 30 pounds of weight gain. In December, researchers from Johns Hopkins and the University of Maryland in Baltimore had also published a study that found that out of 800 respondents, 60% had indicated their drinking had increased in the last 1.5 years compared to the time before COVID. more than 45% had attributed that increase to an increase of stress. The APA also had concluded that 1 in 4 adults reported drinking more to manage their pandemic stress. By June 30th of 2020, because of concerns of COVID, about 41% of US adults had delayed or avoided medical care, including urgent, emergent, and routine care. So I bring up these statistics to highlight that you're not alone, and that if we recognize the problems that the last year and a half may have created, we can better focus on solutions and new ways of doing things in this new norm. Next slide. Unfortunately, there is no quick and easy way to lose weight. And with gym closures and mask mandates, I know it can be challenging to resume a normal exercise routine. But please remember that weight loss is much about balance and consistency as anything else. Next slide. So here are some tips to help you for weight loss. The biggest one I can say is gradual and consistent weight loss helps to keep the weight off and avoid undue stress to your body. So radical diets and exercise restrictions of calories can actually cause more weight gain in the long run and overall frustration. It's important to try to lose weight slowly. So at a rate of about 1/2 pound to 2 pounds per week is a good goal to have. And to lose 1 pound per week, you need to consume about 500 calories fewer a day than what you actually burn. So counting calories can be done via applications or looking up calories online. There are even hard copy books that have a general list of how much a portion size may have. Meal prepping and avoiding eating out is a great way of trying to keep track of calories as well, because you have a little bit more control. If you do eat out, try picking lower calorie meals, because many restaurants have also started to post nutritional information on their menus and online to help navigate those choices. It's also best to combine eating and drinking less with being more physically active. Keep in mind, though, the majority of weight loss success is usually derived in what you eat or don't eat. To put calorie burning into a little bit more perspective, keep in mind that 45 minutes of brisk walking may burn 100 to 150 calories. This is roughly equivalent to 12 ounces of beer, 4 ounces of wine, 1 ounce of cheese, 1/3 of a serving of cake, 1/2 a cup of rice. So it's clearly easier to consume calories than to burn them. Next slide. So there are many benefits to exercise aside from weight loss alone. Exercise helps to increase your overall cardiovascular health, helps to reduce stress, and can also help to promote better balance and avoid injury from fall. It gives you energy, it helps you sleep better, and it can also lower your risk of chronic diseases, including dementia and depression. Next slide. So what is enough exercise? 150 minutes per week of moderate intensity aerobic activities, or 75 minutes per week of vigorous aerobic activity, or a combination of both is what's recommended. To promote and maintain health, older adults should participate in moderate intensity aerobic exercise for at least 30 minutes, 5 days a week, or vigorous intensity aerobic exercises for 20 minutes, 3 days a week. To reduce the risk of falls and related injuries, trying to engage in exercises that improve balance, such as various stretching techniques, Tai Chi, and working on core exercises to strengthen your core muscles is really important. Adding moderate to high intensity muscle strengthening activities, such as resistance or weights, at least 2 days a week is also helpful. The big bullet point is spend less time sitting. So even light intensity exercise or activity can offset some of the risks of being sedentary. Increased health benefits have been seen with being active at least 300 minutes or 5 hours per week. Keep in mind, you want to increase the amount and intensity of exercise gradually over time. Start slow and build it up. This helps prevent injury and also makes exercise more enjoyable. So physical activity is one of the best ways to help keep your body and brain healthy. Next slide. So a lot of people might ask, what's the difference between moderate and high intensity exercise or vigorous exercise? So some examples of moderate intensity aerobic exercises include brisk walking, at least 2.5 miles per hour, some water aerobics, Dancing, whether it's ballroom dancing or social dancing, gardening, doubles tennis, and biking slower than 10 miles per hour. Conversely, vigorous exercise includes things like hiking uphill or hiking with a heavy backpack, running, swimming laps, aerobic dancing, heavy yard work that might include digging, and singles tennis, as well as cycling 10 miles per hour or faster and jumping rope. If you're concerned about wearing a mask while exercising, I would recommend exercising at home. If you have the use of some home equipment, I would definitely take advantage. If not, you can also use exercise videos. There's a lot of free content online that can help you and for various levels of expertise. And if you are able to exercise outdoors and the area is not crowded, for the most part, you could probably achieve this without wearing a mask. But I would encourage you to keep one on you in case you run into a situation where there are people around or a crowd and you should need to use it. Many gyms are trying to accommodate patrons by taking appointments and sanitizing equipment at increased intervals. However, the majority are still requiring the use of masks, especially with the latest mask mandate in place. Regarding, I always say movement prolongs life and increases quality of life. So if you're still not convinced that exercise is helpful, then maybe these bullet points can help convince you. So it can lower your risk of heart disease, stroke, diabetes, can lower high blood pressure and risk of dementia, as well as several types of cancer, and reduce the risks of complications. Can reduce some of the complications from pregnancy as well. It improves sleep. It improves things like insomnia and conditions like obstructive sleep apnea. It can improve cognition, including memory, attention, and processing speeds. It helps with weight loss. It increases bone health and balance, which reduces your risk from injury from falls. And it decreases symptoms of depression and anxiety by increasing endorphins and creating a healthy outlet for stress. Exercise improves quality of life and your overall sense of well-being. Next point. So proper and well-balanced nutrition is also very important for your general health, for immunity, for weight management, and moderation rather than being really restrictive or overly restrictive can be helpful and more sustainable. Next slide. Unfortunately, I don't have a quick fix. I recommend that you enjoy a variety of foods to help reduce your risk for developing chronic diseases such as high blood pressure, diabetes, and heart disease. Be sure to choose from foods with little or no added sugar, saturated fats, and sodium. Make sure you're getting enough protein throughout the day to maintain muscle mass. 0.8 grams per kilogram of body weight is generally recommended. Try adding things like seafood, dairy, fortified soy alternatives, things like beans, peas, lentils to your meals to help maintain that muscle mass. And focus on nutrients that you need, including things like potassium, calcium, vitamin D, dietary fibers, and B12. I recommend getting this from diet rather than relying on supplements alone. Foods like fruits, green leafy vegetables, dairy, etc. are very nutrient rich. Foods such as citrus, bell peppers, broccoli, spinach, green tea, turmeric, and nuts such as almonds have been known to help with immunity because they are rich in nutrients such as vitamins A, C, E. They're high in antioxidants and have some anti-inflammatory properties. I will say though, there is no magic immunity boosting food. Eating one of these things isn't going to guarantee great immunity. Focusing on proper overall nutrition, healthy weight, reducing your stress levels, sleeping well, exercising is the best way to maintain a healthy immune system. Other tips are add fruits and vegetables to meals and snacks, and you can look for frozen, canned, or ready-to-eat varieties if slicing or chopping is a challenge for you. And then keep in mind too that the ability to absorb things like vitamin B12 can decrease as you get older, whether it's due to medications or certain conditions, but eating enough protein and fortified foods such as fortified cereals can help you meet your B12 needs. You can always consult with your doctor if you feel you need a B12 supplement. With age, many of us lose the sensation of thirst. So you want to make sure you're drinking water and often. And if water is not your thing, while it's the preferred thing to drink, you can try things like low or fat-free milk. lactose-free options or fortified soy beverages, fruit juices as well, to help you stay hydrated. But you really want to limit beverages that have a lot of added sugars and salt. And then if you'd like to learn more about how to get enough of each food group and how much calories to help maintain, there are some resources, especially with the www.myplate.gov, which we'll go over in a little bit. But the big thing is try to make eating a social event. I know it's a big thing for most of us to share a meal with loved ones. So you can do this not only in person, which these days is more difficult, but virtually as well. Next slide. So this is an example of the MyPlate plan that's offered through the USDA. Again, going to that website, www.myplate.gov, brings you to this option here, and you can enter your age, gender, your weight, your height, and your level of physical activity. And based off of that, it'll recommend a calorie goal for you to have in a given day. And whether you're trying to maintain your current weight or lose weight, the calorie goals are different. Next slide. So this is an example for a 200-pound male who's 5'8", who's looking to lose weight. And it just gives you an idea of how many servings of fruits, vegetables, protein, grains, things that you should have in your diet, and can give you some guidance as to what a serving size needs to be. Next slide. So as mentioned at the beginning of the presentation, alcohol consumption and as high as 60% of some study participants was noted to increase due to pandemic stress. So I bring this up because being mindful about how much alcohol you're consuming and the intent behind drinking is very important. Using alcohol as a means to cope with stress or escape can become a slippery slope and is definitely not recommended. Next slide. So to kind of put it in perspective in terms of definitions, the NIAA describes binge drinking as getting your blood alcohol level up to 0.08% or higher. And typically to achieve this, you're talking about drinking 5 drinks in a male or 4 drinks in a female in about a 2-hour span. Heavy drinking is something that can be defined in a male as 4 drinks in one given day or more than 14 drinks in a week. And for a female, 3 drinks in a given day and more than 7 drinks per week. Next slide. So why am I even bringing this up? Because there can be consequences to alcohol consumption, and some of them include fatality and injury. Alcohol-related deaths are increasing in the United States. Alcohol is a factor in about 30% of suicides, 40% of fatal burn injuries, 50% of fatal drownings and homicides, and 65% of fatal falls, and around 30% of overall motor vehicle traffic fatalities involve alcohol as well. So there can also be alcohol-related blackouts, which put people at risk. Blackouts are gaps in a person's memory for the events that occurred while they were intoxicated. These gaps can happen when a person drinks enough alcohol to temporarily block the transfer of memories from short-term to long-term storage, known as memory consolidation. And this occurs in a part of the brain called the hippocampus. Chronic alcohol abuse can cause health problems, including problems with memory in the long run. Drinking is associated with a number of health problems that can make many chronic conditions worse. Research has also shown some association between alcohol and breast cancer in postmenopausal women, that drinking as much as 10 grams of alcohol on average on a daily basis, which is less than what's found in one standard drink, can increase the chances of breast cancer in a postmenopausal woman by around 9% compared to the general population. Research has also shown that misuse increases the risk of liver disease, cardiovascular disease, worsens depression, can increase risk for stomach bleeding, and several other cancers. And it can also make managing chronic conditions like high blood pressure and depression worse. It can worsen your sleep habits. And it's just something that's really important to keep in mind. So I know the argument sometimes for this is, well, I heard that drinking a glass of wine a day can have a lot of health benefits, especially for the heart. And while this is something that's been said, there's a lot more to this story. No research has proven a cause and effect link between drinking alcohol and better health. Components in red wine, such as flavonoids and antioxidants, can potentially reduce the heart disease risk, but these flavonoids and other antioxidants are found in other foods like grapes, red grape juice, or blueberries, so you don't need to necessarily consume alcohol or red wine to get those health benefits. Next slide.
I think that Jenny's frozen up here. We'll reach out to her and have her reboot. The wonders of technology, right? In the meantime, if you guys want to post if you've got questions that are coming to mind, please post them on the chat. And I'm so sorry this is happening. We're reaching out.
Can you hear me?
Oh, there she is. Now you're back, Jenny. You're back. Good.
Do you mind just letting me know the last thing that you heard?
You just start with we didn't hear anything about sleep. You had just turned to this slide.
Okay, good. So I was sorry about the interruption, but I was saying with sleep, notably insufficient sleep has been linked to the development and management of a number of chronic diseases and conditions, including type 2 diabetes, cardiovascular disease, obesity, depression, and cognition. Next slide. So here are some sleep tips from the American Academy of Sleep Medicine. You want to keep a consistent sleep schedule. Get up at the same time every day if possible, even on weekends and during vacations. You want to set a bedtime that's early enough for you to get 7 to 8 hours of sleep. Don't go to bed unless you're sleepy. If you can't fall asleep after about 20 minutes of being in bed, get out of bed, do a quiet activity without a lot of light exposure. And it's especially important to not get on electronics. And then when you feel a little bit more sleepy again, try going back to bed. You want to try to establish a relaxing bedtime routine, maybe an hour before you intend to fall asleep. And you really want your bed to be used for sleep and sex only. So you don't want to do things like work in bed or use devices such as electronics, especially trying to avoid any screens or electronics 30 minutes before bed can really go a long way to help with getting good sleep. You want to make sure that your bedroom's quiet and relaxing. Keep the room at a comfortable and cool temperature. Anywhere from 65 to 72 degrees Fahrenheit seems to be a good temperature for that. Again, limit light exposure and bright lights in the evening. Some people even use blackout curtains or sleep masks to help with this as well. Don't eat a large meal before you go to bed. This can definitely interfere with your ability to have a good and restful night's sleep. So if you're hungry at night, try to eat something light or a healthy snack, but avoid a heavy meal or a heavy snack. And also trying to avoid consuming alcohol before bed, and reducing fluid intake a couple of hours before bed can be helpful as well. Avoid caffeine in the afternoon and evening as well. Exercise is also helpful in trying to regulate sleep habits. So part of what we talked about before is making sure that you incorporate that. Next slide. So mental health has an impact on physical health. Making sure that you take time to decompress and address stressors, anxiety, and concerns are really important. Next slide. A big part of mental health is caring for yourself by incorporating everything that we spoke about. So exercising, eating well, drinking in moderation, and sleeping well. Suppressing how you feel or burying yourself in work does not help resolve feelings of depression, anxiety, or general stress. Taking time to acknowledge how you feel allows you to take steps to get to the root of why you might feel that way and how you can cope with those feelings. Many of us also find it easier to take care of those around us and save ourselves for last. So it's really important to carve out time for yourself, whether it's to just relax, to just be, or to engage in an activity that's helped clear your mind and allows you to rest. It's just really important to take time for yourself. Even if it's 10, 15 minutes out of the day, it's definitely recommended to take breaks. When you are feeling stressed, stopping to do different exercises such as deep breathing exercises or meditating or even journaling, writing down how you feel can be helpful so that you can be more recharged for the task ahead. Especially during the pandemic, for those of you who are working from home or who are home and not really going out, still maintaining a sense of a structure of the day can be very helpful for your mental health. So still get up at a certain time, get dressed, make yourself breakfast, maybe plan to do some exercise or get out and do something. Take time to connect with loved ones and friends, whether it's in person or virtually. And then also try to avoid a continuous news cycle, especially if the news is overwhelmingly stressful or negative. It's okay to take news breaks or consume your news in other ways rather than having the TV on 24/7. There are also some cognitive behavioral techniques, such as thought charts, that can help with ruminating thoughts. Next slide. So this is an example of a thought chart. So it basically walks you through the ability to identify what situation or feeling has arose, and it lists a few questions that you can go through. You can rate the emotions. You can also kind of investigate what unhelpful thoughts or images came to mind, and try to see, what are the facts surrounding that. And the idea is to then try to use logic to maybe talk yourself through it. So asking yourself questions about, is it possible that maybe this is more opinion rather than fact, or where is this necessarily coming from? Trying to find a more alternative or realistic balanced perspective is important too. So it just kind of asks you to take a look at bigger picture or try to find another way of seeing the situation. What advice would you give to someone else if they were in your situation? And then it kind of has you go back and rate how you're feeling. So this is certainly something you can try to do on your own, or this is something that might be explored if you work with a therapist as well. But it's just to kind of give you an idea of how you might be able to talk yourself through some of these stressful thoughts. Next slide. So there are many resources available to help with mental health, from self-help books to different applications. This is a very simplistic list, but there are some books like the Mind Over Mood book or the Headspace app to help you with guided meditation. Finding a therapist can be very helpful to just talk about how you're feeling and try to have an outlet to explore where your stressors are coming from and learn about techniques to help mitigate them. Psychologytoday.com is a good resource to finding available counselors, which I know has been especially difficult as the demand for this has gone up. And then don't forget that your primary care doctor can also be a really great resource in helping you with your underlying anxiety and depression and general stress. Next slide. So I recognize that I might be a little bit biased, but I truly believe in the benefits of being connected with a good primary care doctor. And this helps you to stay ahead of your health needs and not just be reactive to problems that are happening. So really, next slide. I encourage you to get back to taking care of yourself, resume age-appropriate screening, schedule an appointment to meet with your primary care doctor, talk to them about your general health, your alcohol intake, your weight, your sleep, your stress. Make a list of your concerns or questions that you want to address during the visit so that you can help set an agenda and make sure that you're heard and that all of your points are addressed. And then you want to make sure that all your immunizations are up to date. and discuss precautions before traveling or resuming activities. And this is a good forum, especially as recommendations are changing, talking to your doctor about what to do with COVID vaccines and things of that nature and different restrictions. And this would be a great opportunity for you to do that. Next slide. So just to let you know, Overlake has wonderful primary care clinics. Among them is also the concierge care practice. And I just included our phone number and address so you would have that information available if you're interested in learning more about our practice. Next slide. So I really want to thank you all for allowing me to go over these tips with you and present this. And I'd like to open up the floor to any questions.
Jenny, this while we wait for more questions to show up in the chat, or if you raise your hand, that's another way for us to be able to call on you for those of you in the audience. One of the questions, you did an incredible job answering basically every question that was submitted, except those around the vaccine in particular, both the booster and then also questions around which types of autoimmune issues would qualify somebody to get that third shot even now. I know that maybe you could provide, maybe taking that first the question about, where which immunosuppressed, conditions would warrant you somebody getting that shot immediately. If you could take that, and then between you and Mike, talk about where we are with the boosters. Mike, I know that you probably have the best information about when Overlake will be providing those boosters, but there are many questions that we received that had to do with the booster.
Sure. So regarding the immunocompromised, that is defined as people who are moderately or severely immunocompromised. So that's people who are currently getting active cancer treatments, solid organ transplant patients who are on immunosuppressive drugs, stem cell transplant patients within the last 2 years who have also been taking immunosuppressive drugs, patients with some primary immunodeficiency disorders such as DeGeorge syndrome, and then patients with advanced or untreated HIV, and then patients who are on high-dose corticosteroids or other drugs that may suppress the immune system. Those are the criteria currently for patients who should be getting a booster now.
Just as a follow-up to that, alopecia areata was a part of the question about which autoimmune diseases would qualify or not. Do you happen to know whether that would qualify?
I don't believe that alopecia areata qualifies under those definitions.
Okay, all right. Mike, could you address, please, just where we are at Overlake in terms of your best thinking about availability of the booster for the general public? And
yeah, so one thing that this pandemic has taught us, among others, is that it's very fluid relative to what we learn and when we learn it, and so there's not generally a long lead time with getting information to the point of implementing it. So unfortunately, we've not gotten a lot of information from the CDC about firm availability dates and dates that and really the rollout of prioritized population, other than what Dr. Rabbat spoke to. But we will continue to be in the business of leading the Puget Sound in our vaccination partnership on the Microsoft campus and administering those booster shots. Then, the Biden administration has given some indications that those could start as early as September 20th, and that it would likely follow the same algorithm that the first rollout, which was, the most vulnerable populations, healthcare workers, et cetera. But that's about all I can tell you. Our vaccine clinic out on the Redmond campus is still operating, although, it's dropped off considerably. I haven't looked recently at how many vaccines we have provided, but it is an enormous number of vaccines that have been provided on that campus and have been a great success for the community. So that would be my answer: is we expect them, we support them, we plan to be an active site in delivering them.
And if I could just add on, I know that there's a lot of headlines in the news about information that boosters would be helpful, studies that come out from the pharmaceutical companies. I want to remind you that while these are just still preliminary studies and official recommendations are still forthcoming. So while these are encouraging things to hear in the news that these are being studied and that boosters may help us further, I would really strongly discourage people from taking matters into their own hands and going to get third vaccine doses without fully disclosing that that's their third dose and not first and second. The priority right now is really to try to get unvaccinated patients and population vaccinated. So we don't want to take available vaccines away from people who are very vulnerable right now.
Good. I'm sorry, I don't have names to associate with some of these initials on the screen. SP, somebody with the initials SP has a question. So you could unmute and fire away.
Thank you. Thank you, Doctor, for such a beautiful presentation. My name is Sucheta Pardikar, and I associate with India Association of IAWW, Western Washington. And my question to you is regarding another type of vaccine, which is shingles. I'm 59 years old and I haven't gotten my shingles shot yet, and I'm very afraid of getting side effects and stuff like that. And so I've had my COVID vaccines a while ago. It's almost about 5 months now, and I am thinking, like, before they allow us to get another, is like what is your take on that? And I know I'm supposed to take it, but like, how do I be courageous and go do that?
Well, I appreciate you joining us today, Sucheta, and thank you for your question. So the shingles vaccine is really strongly recommended because it's about 97% effective, whereas the older vaccine that was available, Zostavax, was only about 65% effective in preventing shingles. And in times of stress, which now definitely qualifies, things like the reactivation of chickenpox, which is shingles, can happen. And why we push vaccination for it is because it can cause nerve damage in the long run with a complicated outbreak of shingles. So the vaccine is very helpful in at least reducing that risk. While there are side effects, things like vaccine site inflammation or tenderness, some people report a mild elevation in temperature, not quite a fever, but a mild elevation, feeling achy for about 24 to 48 hours after, or even some flu-like symptoms. Usually the symptoms do abate without any intervention other than rest and supportive care. In terms of the timing, with the COVID vaccine, there's at least a 2-week buffer that is recommended before you take the vaccine and after the vaccine from taking any other vaccine. So that includes things like the flu vaccine and your shingles vaccine. This might actually be a great time to get your shingles vaccine because you would be able to, in theory, get the first dose now, wait a month or at least 2 weeks before the flu shot starts to roll out. And then in the fall, with the advent of maybe boosters becoming available, you'll be well within enough time space. So this would actually be a perfect opportunity to get your shingles vaccine.
Correct. Thank you. So, but I have heard that there are 2 shots in shingles vaccine. So how much is the duration between one and the other next one?
They can be given at minimum 2 months apart, but as the 2 months to 6 months is the window. So it would be perfectly fine to get one now and one in 6 months time, and you would still be far enough apart from other vaccines that you wouldn't have to worry.
So then I should get the single shots now and then wait and get my flu shots in fall, and then another 3-4 months, then get another second shot of shingles is what you recommend, right?
So the minimum time in between would be 2 weeks. If you want to space out a month, that would be best.
Okay.
But yeah, so I would recommend getting a shingles vaccine around now, the flu shot potentially early October, and then when it's appropriately time for you to get your booster based off of the last vaccine you received, in theory, it should be timed properly. And then 6 months after your first shingles vaccine, you can get the second one and complete the series.
Oh, okay. So you have to wait for 6 months to get the second shingles shot. Is that right?
That's the maximum amount of time. 2 months.
Oh,
is
maximum.
the
Minimum. Okay. Okay. Got it. Thank you so much.
You're very welcome.
Okay, well, and those shots are available, I know, at all the primary care clinics as well. So any other questions? This has been incredibly helpful, lots of great material, and I'm not seeing any more hands or questions in the chat. Jenny, you may have just done it all, and so appreciate it. What a great program. I feel like I have come away with having learned a lot. Oh, okay, Joyce Turner has a question. Joyce, if you could unmute yourself.
Okay. My question is, how do you exercise when you're 90 years old and you are confined? You put so much, it was depressing to me to put so much emphasis on exercise when it's not realistic to do much of that.
So I understand your concern, Joyce, and thank you for raising the question. This is where some of those online videos can be helpful, especially for seniors. There are definitely exercises that you can do to help promote balance and strength that are chair exercises even. So it's hard to give specific recommendations for such a wide variety of patients attending, but there are definitely resources out there that are available for seniors, and specifically chair type exercises that can be very helpful as well.
And how do you find those?
They're available on YouTube and through Google searches.
Okay, thank you.
There's a question in the chat. What should people do if they or a loved one are having a crisis related to mental health, depression, or anxiety?
So I would definitely try to reach out to your primary care doctor if you have one. There are also crisis hotlines. Forgive me, I don't have that number. I can pull one up for you.
Great. Thanks, Jen. If you just even put it in the chat, that would, or we can put it in the chat, as a matter of fact. Don't worry about it. Why don't we find it and put it in the chat?
That would be great. There are crisis hotline numbers that you can call if you really don't know what else to do, and somebody can talk you through that or provide you with some resources of how to proceed. If you really don't know what else to do, there's always calling 911 if you feel that your loved one is in danger to themselves. And that can also get resources out to you quicker.
Okay, that's great. Thank you. And we will get that number in the chat for those who would like that. It's a great resource in this community to have that crisis clinic number. I think, failing any other questions or hands coming up on the screen, I think we'll wrap up. I've got to, just Jenny, thank you again. Thank you for all the time you put into this presentation. There was material here that I think was new to all of us. So it was good to see it and be reminded of what maybe we already did know, but be reminded again of those things that are just all helpful when we're working on our own wellness. And Mike, thank you. Thank you for joining us and for introducing Jenny and for helping field the questions that on the boosters and just getting a sense of how things are changing so quickly. You will be receiving a follow-up survey shortly from the Foundation office. Please take some time to complete it. we really do rely on your feedback to plan future Circle of Excellence seminars. This topic today about wellness was an example of what we learned from you, and where many of you suggested that you wanted to hear more about. So we really do listen and take our cues from you in terms of what we can present as we want to continue, as Mike said, to to use these sessions as a small way to show our thanks to all of you for all the support that you provide over Lake. We also, again, like I mentioned at the outset of the program, we'll send along a recording of this session if you want to share it. And please stay tuned. We'll be sending more information shortly on our fall Circle of Excellence presentation. So just stay tuned for that. And just thank you again for all you do for Overlake. As a nonprofit, we do rely on your support in order to provide our patients with that high level of compassionate care and advanced care services that has become our trademark here. Physicians like Jenny, we're proud to have, and they can go anywhere, but we have been able to attract high-level physicians and others, service of her colleagues, because of the equipment we provide and because of the way that our community supports us and her. So thanks again for joining us. Have a great weekend and take care of yourselves.
Thank you.
Thank you.